Hi guys, this is me Gayatri.
Prakash and welcome to my page. എല്ലാവർക്കും എൻ്റെ പേജിലോട്ട് സ്വാഗതം. So today I would like to discuss with you all about 27th August 2022 OET exam, in which I'm going to detailedly explain to you all about OET writing. Okay, so what was the letter? It was a known case letter, and as we know that when the known case letter will come, it is very important to exclude social background of the patient. And what was the case, and what is the patient details, and what they have given in the case notes, everything we are seeing in detail. Okay, so patient name was his name was George Woodward, and he is 82 years old man. Actually, the patient was admitted in the hospital for his so-and-so complaints, and the patient denied for some treatment, and also patient was treated conservatively and he got discharged. Since the discharge, the patient has been under the home visit of community nurse. So when the community nurse was doing a visit, and she came to know that the patient condition is improving, and also patient needs some more treatment at hospital. Thereby, she is writing this letter to the same doctor who was treated him when he was in the hospital. So it is known case letter. Okay, so we'll see the patient details. Patient name George Woodward, and he is 82 years old. What is the patient present complaints, which means why the patient got admitted? The patient got admitted on 18th of December 2021 due to mixed burn in the right hand. And doctor advised him to undergo for skin graft procedure. However, the patient refused. Therefore, patient received adequate treatment and management, which includes daily wound dressings, and also they have provided analgesics and antibiotics. And patient showed some improvements in his condition. Thereby, patient got discharged on 27th December 2022. And since the discharge, community nurse is doing a home visit for the patient. So the first visit was happened on 1st of January 2022. So during the visit, the community nurse assessed a patient wound, and she came to know that patient wound healing is slow, and there is no foul smell, and there is no infection, and also it looks healthy except slow wound healing. And the second visit, she made it on 4th of January 2022. So again, she came to know that the wound healing process is slow and there is no new complaints. And the last visit happened on 8th of January 2022. So in that, patient is complaining of pain because patient has already a history of rheumatoid arthritis, and thereby patient is complaining of pain and he unable to walk properly, and also he is finding weakness. And patient wound was assessed by a community nurse, and the wound is free from infection. There is no scar, there is no excoriation, and there is no odor or the foul smell. And also it is a perfect time for the skin graft. Thereby, community nurse discussing with the patient, like she is explaining to the patient it is the right time to undergo for a skin graft. At last, the patient also accepted the community nurse advice, and thereby the community nurses are writing to a patient's doctor about the condition, and she is sending the patient to the doctor for her skin graft preparations. Okay, so this is the story about our patient, and this was a case note. And it is a very simple letter. While I was read the patient case note itself, most of the students come to know that it is a very simple letter, and yes, my students also was done in a very good way. So now, how to write a letter? Okay, so as usual, to write a letter, the first main thing is date. So here they have given a date is January 8, 2022. That was the today's date, and that was the date the community nurse made a last visit. So thereby she is referring back to the same doctor. So the date of writing the letter, the date is 8th of January 2022. Now coming to the point of address. So as usual, if they have given the doctor's name, you can write the doctor's name, doctor and the name. and then what is the specialty, what is the hospital name, and the remaining address. And when we are writing address, as we know that the first letter of each word should be capital. And now salutation, which means giving an intro to a recipient of the letter. So dear doctor and his second name. If there is no name, dear doctor, comma. And reference. In the reference, we are writing the patient name. What is the patient name? Is George Woodward, Mr. George Woodward. And what is the age? It is 82 years old. So age 82 or 82 years old. Like that we can. Otherwise, we can write an 82-year-old. Like that we can write it. Now, introduction. So patient is on wound healing process, and also it's the right time to undergo skin graft, and also patient is accepted for skin graft, isn't it? So these are the points we have to keep it in our mind. Now we are going to make an introduction. So two ways we can write an introduction because of the known case. One is I'm writing to update the current condition of. The second way, I'm writing to refer back because we are referring back to the same person, to the same doctor, right? So that's why we can write it in a two way. Either I'm writing to update the current condition of Mr. George Woodward, who is willing for skin graft following a burns. Full stop. He requires your further assessment and treatment because he can assess the patient for the skin graft. Either it is now right time to do a skin graft, and if it is something like that, as per the skin graft, that he will start the treatment. So this is one way of writing an introduction. Then another way, I'm writing to refer back, or I write to refer back Mr. George Woodward, who is willing for skin graft following a burns, full stop, and then you can write he requires or he needs your further assessment and treatment. Like that also we can write it. Or else we can write who is recovering from burns. Who is recovering from burns. Full stop. And then you can write it. He needs your skin graft surgery. He needs your skin graft surgery. So like that also we can make it. So n number of ways. One is the main concept is here. The patient is accepted for skin graft. Thereby we are referring the patient to the same doctor to perform the skin graft, and also doctor will do an assessment. It is the right time to do a skin graft or not. Clear? So that things better to mention in our introduction. That will be highlighting our introduction. Okay. But we can write it in a very different way. Like that's what the way I said, like who is recovering from burns and he needs to be assessed by your service for skin graft. Like that also he needs to be assessed by your service for skin graft. Like that also we can write. Or else who is willing for skin graft following burns, he needs your further assessment and treatment or further assessment and management. Like that also we can write it. N number of ways we can write it because this is the main concept. Now coming to the point of present medical history. So here, as we know that it is not necessary to write about the social background because patient was rheumatoid arthritis and patient was having hypertension and so many past medical history, and patient was on medication for the same. So thereby it is not necessary to mention to the same doctor who is going to look after the same patient. So thereby we are just skipping the social background part entirely. But present medical history paragraph, how to start? So every doctor knows about their patient, unless otherwise if you are giving them some information or hint, oh, this was the patient, this was my patient, right? So thereby the present medical history can start with the patient was admitted to the same doctor previously, and this all those things was happened, but it is not necessary to elaborate much. The elaboration has to be given into the home visit. So we can start Mr. Woodward was admitted on, as the admission date was like 18th December 2021, following or due to burn in the right hand. So thereby what they have done, therefore his wound was cleaned and dressed and also was commenced on antibiotic as well as analgesics. And then what happened? As the patient refused for skin graft, he was treated with it conservatively. And what happened at last? and patient showed some progress in his condition. He was discharged on 27th December 2022 with the home visit help. Like that. And then the continuation we are writing with the third paragraph. So where we used to write a social history, in that paragraph we are starting like this. Mr. Harwood has been under my home visit, because I am the one is subject, like I am the one is writing this letter to the doctor. So he has been under my home visit. Okay. So Mr. Harwood has been under my home visit since the discharge for the wound care management. During my home visit, he was found to have pain, weakness and poor mobility. And also he is on medications for the same. Regarding his wound, or else you can on assessment, his wound healing is slow. And what else they have found? There is no infection, odor and color changes. However, he has slow wound healing process. Okay, so we are just starting the present medical history paragraph. Mr. Woodward was admitted on 18 December 2021 due to burns in the right hand. Therefore, his wound was cleaned and dressed. Full stop. He was commenced on antibiotics as well as analgesics. As he refused to have skin graft, he was treated conservatively. Full stop. Fortunately, he showed good progress in his condition and he was discharged on 27th of December 2021 with the home visit. So that is the second paragraph next to the introduction. Then third paragraph. Mr. Woodward has been under my home visit since the discharge he has been under my home visit. During my home visit, he has complained of weakness, pain, and also he is on medication for the same. On assessment, he has no infection, color changes and odor in his wound. However, he has slow wound healing process. On today's assessment, his wound is ready for skin graft. Therefore, he was discussed about the importance of skin graft and he was accepted for the procedure. So finish. Now recommendation paragraph. Mr. Like, or else you can, in view of the above or whatever the way you can start, you can start like it would be greatly appreciated if you could take over Mr. Woodward and assess and provide appropriate treatment like that. You can keep a full stop. Your concern on his condition is immensely appreciated, like that. Or else you can write, it would be greatly appreciated if you could assess Mr. Woodward and perform a treatment or provide further treatment as you feel appropriate, then full stop. You can write, your treatment on his condition is immensely appreciated. Then if they have, then conclusion, please contact me for further details. And then if you want to conclude the letter, like if there is a name, yours sincerely. If there is no name, yours faithfully. So this is a very simple letter. So this is one way of writing a letter. Like, there are multiple ways we can form the sentence and we can write it. But I'm just saying that these are the main points that we need to include in our letter. So this is more than enough for the doctors to know. And also we are just giving a hint. There was one patient, so-and-so was admitted because of this reason. So just we are giving the hint. That's why we are just writing. The first line was like, he was admitted in the hospital under your care. Like that also we can start. Mr. Woodward was admitted on this day in the emergency department under your care following a burns in the right hand, or else you can write due to burns in the right hand. Like that we can write it. So these are the ways we can initiate. But the main thing is what exactly happened during your home visit and what you have done, what you have found out, and how the patient accepted, and then thereby you're writing this letter. So this is a very simple letter. I hope you all have done in a very good way. My students also said to me the same. Anyhow, hope for the best result. And in my next video, I would like to discuss with you all about the OET speaking, like what was the topics they have asked on 27th of August exam. So we'll see in the next video. Okay, so whomever wants to join in my class, you can contact us anytime. Our number has given in our description. We have 40 days, 30 days, 20 days, 10 days, 15 days, and mock batch, and we have a crash course, and we have a 60 days classes, beginners classes are ongoing. So whomever wants to join, you can join at any time. Okay, so until then, bye bye.